In the fall of 2020, the Georgia chapter of PNHP attempted to advance a resolution in support of Medicare for All in Atlanta City Council. After months of discussion and strategizing within our group, making outreach, and communicating with a city council member, we were optimistic about getting the resolution introduced and passed. But on the day it was to be voted on, an amendment was added that watered down the resolution, in effect rendering it meaningless. In the summer of 2022, 2 years later, when our chapter created a steering committee and began organizing for new actions, the idea of advancing local resolutions was again introduced. Understandably, following the experience from a few years before, we really had to ponder the prospect of approaching Atlanta City Council again. We considered that a lot had changed since that time. On an international level, we were still dealing with the COVID-19 pandemic and all of its impacts on our healthcare system. Nationally, we saw the introduction of the 2022 Medicare for All Act with its over 120 co-sponsors in the House of Representatives. And locally, we were seeing shifts in the makeup of City Council with the election in 2021 of some more progressive council members, a new City Council president, a new progressive mayor in City Hall, and also some shifts in committee leadership on City Council that proved useful. Organizationally, we had amazing tools available through PNHP National and through Public Citizen. With these online toolkits, links to relevant articles, and clear talking points, we were equipped with everything we thought we needed to try again. The first step was identifying allies on City Council, and this just took a lot of Googling in the beginning. I started out sending emails to those council members who I thought might be most likely to support this initiative, and that included the newly elected council member for my own district. Not only was she very progressive, she was also highly accessible, providing coffee hours to meet with constituents every month at different coffee shops in her constituency, in her district. The second council member I chose was an at-large council member who was also recently elected and took a progressive stance on many issues. The third council member was someone with whom I'd collaborated on a project to establish a food pantry in her district back in 2020. And the fourth council member I contacted had served on council for many years, and I was just surprised by the response to my initial outreach. Of the 4 members I reached out to, all responded immediately with support, 3 of them with very enthusiastic support, vocalizing intent to introduce the resolution themselves at the next council meeting. I quickly sent draft language when that was requested. I was able to immediately produce that because of the information available through the toolkits from Public Citizen. The pace of things just was really surprising. It took off. I realized that I'd better quickly inform each of these council members to whom I'd reached out to let them know of their colleagues' support for the action so that they could work together to introduce the legislation. Indeed, by the time the resolution was introduced a couple of weeks later, it had several co-sponsors. Over the ensuing weeks, I communicated with council members to provide them with updates on any new developments that I thought would be relevant to the resolution. And during the few weeks between my initial outreach to them in July and the resolution's ultimate passage in September, there was plenty to share, including research that came out showing that hospitals that serve people in predominantly Black communities struggle more financially. There was also the news of the threat of imminent closure of Atlanta Medical Center, which is one of our 2 level 1 trauma hospitals in the metro area, which serves a large underserved population as well. And I also passed on to the council members contemplating the resolution that this Georgia State Democratic Convention passed a resolution in support of Medicare for All early in September. So at the same time that I was providing this information to the council members to educate them further and bolster their advocacy efforts with other council members, I was seeking critical information from them about what we needed to do to get our resolution passed. I approached them with humility and let them know that I really don't know how this process goes. And I asked them, what are the things that I can do to ensure that this gets passed? I learned which committees were most likely to take up the resolution and which other committees would need to be involved for it to gain full council approval. I spent a lot of time on the City Council website learning more about the council members and the committees, and that helped me to determine the next tier of members to whom I'd reach out to ensure that once introduced, the resolution would have broad support. At that point, I'd communicated with almost all of the council members. I think I did not contact anyone on Public Safety Committee. I focused mainly on talking with council members on the human services and community development committees, but fortunately my allies on council helped me to know that I also really needed to approach folks on the finance committee. And, one of our chapter leaders also reached out directly to the city council president, who's not able to introduce resolutions, but who can certainly provide vocal support for them. So I kept track of our resolution as it moved through City Council by reviewing the minutes of council meetings and checking in for updates when things weren't clear. I was compulsive about following up with the council members with whom I'd made contact, and ultimately this was a process of establishing relationships through initial outreach and sustained conversation. I tried to be as useful to the council members as possible, and I asked them to help me to understand how resolutions get passed in City Council. One council member was really explicit in giving us instructions or tips or strategies. For example, she told me that public commentary is highly influential to council members and that I should gather a group of 5 or 6 colleagues, regardless of whether they're constituents, and come down to City Hall on a particular date, arrive early, sign up to speak, and deliver 3 minutes of prepared remarks, one after another, before the council committee. Another council member regularly updated me about votes on the resolution when those were coming up, on its passage out of committees, and when upcoming meetings might occur where it would be discussed. And then I also went to the coffee hours with my council member, and I met her in person, introducing myself as the one who'd been emailing her about the Medicare for All resolution. And in person, she affirmed her solidarity again at this casual meeting. So this process really demonstrates that developing relationships with our elected officials is a really important way to strengthen our advocacy. We began this advocacy for the Medicare for All resolution with Atlanta City Council in July. And in September, 5 members of our steering committee for PNHP Georgia made our way down to City Hall with our prepared remarks, 3 minutes each. And while we were waiting in the vestibule, I met one of the council members with whom I'd been corresponding over email and introduced myself, letting him know that we were there to speak about the resolution. At that time, he turned to offer congratulations to me, informing me that the resolution was passed unanimously a few days before. I was obviously not prepared for that and asked for clarification, and he told me that the resolution had good support and they had put it on the consent agenda and it was passed unanimously by all who were present for that vote. So my colleagues and I quickly shifted our remarks to, rather than trying to persuade the council to support this resolution, to thanking them for passing it. And that was that. It was anticlimactic, but it was a success, and along the way we made connections with several local leaders, some of whom I exchanged correspondence with weeks after. Council members really like for their actions to be noticed, so when PNHP and Public Citizen posted on Twitter about Atlanta resolution being passed, and this was tweeted and retweeted by people at the federal level, including folks like Ro Khanna and Pramila Jayapal, I sent our allies a note about that. Whenever an article or an op-ed was published about it, I also sent that to them so that they could see what their advocacy had brought. And they thanked me for my advocacy and stated that they looked forward to working with us again. So that's our story.